to register.
This is the left hip bone. It consists of 3 bones. This is the pubic bone, and this is the ischium, and this is the ilium. Concerning the pubic bone, this is the body, and this is the superior ramus, and this is the inferior ramus. This is the obturator foramen, which is closed normally by the obturator membrane, except for the passage of this tunnel. This is the obturator canal, where the obturator nerve and the obturator vessels passes from the pelvis. The most important thing concerning this area is number 1, the obturator canal. Number 2, this is the body of the pubic bone, the inner side. It is related to the bladder. The second thing, the obturator internus muscle, it arises from the obturator membrane and the surrounding muscles. So if I found a mark like that, so this is the origin of the obturator internus muscle. Concerning the ischium, this is the ischial tuberosity. The ligament attached to it is the sacrotuberous ligament. And also above this, there is an impression here. This impression for the pudendal canal. So if I find here a mark, this is related to the pudendal canal, and inside this canal passes the pudendal nerve and the internal pudendal vessels. It's an important thing. This is the ischial spine, and I have to know the ligament attached to this ischial spine, which is the sacrospinous ligament, is attached to it. The structure related to this ischial spine, from the inner side arises the levator ani muscle. The outer surface of the spine related to 3 structures. The base of the spine is related to nerve, to obturator internus, which passes from the greater sciatic foramen to the lesser sciatic foramen to supply the obturator internus muscle. The apex of this spine is related to the internal pudendal vessels, but the ligament attached to it, which is the sacrospinous ligament, is related to the pudendal nerve. So the pudendal nerve related to the ligament. The apex of the spine is related to the internal pudendal nerve. The base of the spine is related to the nerve to obturator internus. So if I mark the apex, ligament is attached is sacrospinous ligament. Structure related, the internal pudendal vessels. If I mark the base of the spine, so structure related is the nerve to obturator internus. However, the ligament attached here is sacrospinous ligament, and the sacrospinous ligament is related to the pudendal nerve. This is the lesser sciatic foramen, and this is the greater sciatic foramen. And this is the ilium. This is the iliac crest, and this is the iliac fossa. The iliac fossa is the origin for the iliacus muscle and the site of the transplanted kidney. We have here 2 joints. This is the sacroiliac joint between the ilium and the sacrum, and this sacroiliac joint is immobile joint. In front of this sacroiliac joint lies 2 important structures. Here, in front of it is a bifurcation of the common iliac artery into an external iliac and internal iliac artery. Also, in front of this bifurcation of this artery passes the ureter and has a constriction where it passes across the bifurcation of the common, because the bifurcation lies on the pelvic brim, and there is a constriction of the ureter at the pelvic brim. The important joint is, the second joint is the symphysis pubis. And the symphysis pubis is a secondary cartilaginous joint because it lies in the middle line. And this is the symphysis pubis. There is a ligament here. It's called inferior pubic ligament. As the inferior pubic ligament is related inferiorly, here passes the deep dorsal vein of the penis below this ligament to reach the prostatic plexus. So if I mark this area and I say name the structure related to the colored area, the symphysis pubis. Name the structure passing inferior to it. Passing inferior to it is the deep dorsal vein of the penis passing to the prostatic plexus of veins. We have studied already the pubic crest and pubic tubercle. But what's important also is the pelvic brim. The pelvic brim, here is the promontory of the sacrum, and this is the ala of the sacrum, and this is the iliopectineal line, and this is the pubic tubercle and the pubic crest. From this side and from the other side represent the pelvic brim, or the inlet of the pelvis. This is by far the commonest area related to the pelvis, or the reproduction and urinary. This is the sacrum, and this is the first sacral vertebra. This is the second, third, and fourth, and fifth sacral vertebra. This is the promontory of the sacrum, and it has an importance in gynecological examination, so I have to know it. If I mark it, so this is the promontory of the sacrum. If I mark this area, this is the ala of the sacrum. This is the anterior sacral foramina, which communicate posteriorly with the posterior sacral foramina. Here enter the anterior sacral nerve and vessels. We have four: the first sacral, the second sacral nerve, the third sacral nerve, and the fourth sacral nerve. The fifth sacral nerve passes from the sacral hiatus. This is the sacral canal. If I put a mark here, so this is the sacral canal. Structure passing to it: the dura mater, the arachnoid mater, the CSF, the coda equina, which represent the sacral and coccygeal nerves, and also the phylum terminal passes into it. The other opening is the sacral hiatus. And the sacral hiatus, if I point to it, so this is the sacral hiatus. Structure passing through it is phylum terminal passing through it. And the lower sacral and coccygeal nerve passes, because the fifth sacral nerve passes here, and the coccygeal nerves passes from it, and also the phylum terminal. So I have to know this is the sacral hiatus, and I have to know this is the sacral canal. I have to know this is the body of the first sacral vertebra, which is the intervertebral disc between it and the fifth lumbar. Here is the sacro-lumbar joint. This is the promontory of the sacrum, and this is the ala of the sacrum, the anterior sacral foramina. And this is the site for the joints, the sacroiliac joint. sacroiliac joint between the sacrum and the ilium, the auricular surface of the sacroiliac joint. This is a posterior sacral foramen, and this is the sacral canal and the structure passing through it, and the sacral hiatus with structure passing through it. This is the most important features needed in this sacrum.